Assalamu alaikum, ladies and gentlemen. A very warm welcome to Information Technology University's series of podcast. A very warm welcome to ITU FM 90.4. We always try and come forward with either new ideas, something creative, something interesting, but always something very, very useful. And for this, since I'm not an expert in every field, we often have the best people from every walk of life come here, talk with us about their experiences, and something they can share with us and something we can definitely learn from. Continuing this tradition, we would today be interviewing Miss Komal Faisal. Miss Komal Faisal has extensive experience in the field of teaching. She is a practicing psychologist as well. But today, since it's the month of October, we are interviewing her as a breast cancer survivor. And I'm sure she has some interesting experiences to share with us. And like I mentioned earlier, something all of us can learn a thing or two from. So let's welcome her today in this series. Assalamu alaikum ji.
Assalamu alaikum, and thanks a lot for having me here.
Thank you very much for taking out time, because
My pleasure.
October, I understand, must have been a very busy month for you. Obviously, when you've had a journey as difficult, as challenging as yours, it's not always very easy and neither very pleasant talking about it as well.
Well, it haunts. It haunts you. I mean, I would be lying that if I say it doesn't haunt you, but it does haunt. Whenever you have to talk about it, when you have to narrate your story, it does haunt you.
I'm sure of that. But again, thank you very much. It is very kind of you to, I think, put the greater good, put everybody else's benefit above your convenience and your comfort.
Yeah. I think I'll be privileged enough to spread that light, because, I also actually had some knowledge about it, and it was all thanks to different awareness programs which I was randomly attending, not for any purpose at that time, but when I had this thing and then I went this journey, I probably thought that maybe God had destined this thing for me. And so for nothing, I used to go into these programs, for breast cancer awareness programs.
Absolutely. And they proved to be life-changing for you.
Oh, yes, for sure. I learned actually, I diagnosed it myself, right? And it was just a byproduct of that. I learned how to self-examine. And I learned self-examination by attending these breast cancer awareness programs, coming in the university, as a part of faculty, you're there. And,
you just casually stop by, you sit down for the session, you attend it.
Just because I love, I can't stop myself from learning things. So I used to attend that. I'm like, that became a blessing in disguise for me.
Absolutely.
Because I was in a habit of at least doing 1 month self-examination as a part of my regular habit. And I learned it from such programs.
Excellent. And something that we take so lightly or so casually, but proved to be life-changing. Not just life-changing, I think saved your life.
Yeah, because, we are in this, I call it as unrealistic optimism, that, these things won't happen to me. Right. So I think because of this, we are careless about it. Maybe we have that illusion of invulnerability that it's not going to happen to me, and then we are careless and casual about it. But I was not a casual person regarding the health concerns. I was never been a casual person. I've been going for, there was no history of this disease in my family. Right. And I used to get my regular memos done yearly, which every woman should get it done. Everything is going in the right direction. But it happened.
Absolutely. It was destined that way. Maybe.
Yeah, for sure.
I remember my manager here calling me and telling me about this session that we're going to be interviewing a breast cancer survivor, and she told me a few details. I have to mention, I was glad to know that you not only have a background in psychology, educationally speaking, professionally also, you've been teaching also. You've been long associated with that field. I would first like to talk a little about that.
I never left my teaching, to be very honest, when even I was going through my chemo and radiation.
Oh.
I never stopped working.
I would definitely want to know about how your co-workers were, how supportive your workplace was, how supportive were the people over there.
Yeah, sure.
They were?
Yeah, they were. I loved my students a lot, and they know. And when I used to come after my chemo, little low, of course, I would not deny that. But at that time, COVID was actually not there that much.
Okay.
So they used to wear masks in the class. And that was a sheer love and care they were showing it, because they said that you are coming for us.
Absolutely.
And we don't want any infection. You carry any infection from us. So they used to wear masks and I used to teach them. So I think this is a support.
Definitely.
And
definitely.
then, when and my colleagues, everybody was there. And then coming to my family, I've got 3 sons. And, one fine day, my husband and all my sons got a very shorter haircut without letting me know. But I knew why they got it done. Because they knew that I was about to lose my hair. And I had lost a lot. And I got a very, very shorter haircut. And just to make me feel comfortable, everybody in my household was having a very, very extremely short haircut.
To support.
Oh yes, not to make me feel that ways, that I'm, like looking awkward. I mean, like for female, I mean, losing these things is very, like shocking, and you don't know what is happening with you.
Absolutely, because you're already in a vulnerable place. You're already in a bad place.
Okay.
Even a tiny or a minor inconvenience that would not upset you otherwise, maybe upsets you greatly during that time. I think we're moving a bit fast, so I would like to sort of take a step back and start with the very beginning. Which year are we talking about? When did you
2019?
Okay.
2018 in December. 2019. And I self-examined. I thought there's something wrong. I told my husband. And luckily my brother, who's a professor of medicine, he was here in Pakistan. I think there's something wrong. He said, no, you're too super cautious about your health. No, nothing. I said, no, let's get it done. So, and that was a Sunday.
And if you don't mind me asking, what age were you at that point in time?
I was 46 or 7.
Okay.
46 or 7.
Mid-40s.
45, 46.
Right. And you've mentioned there was no family history. You've never had another person in your family have breast cancer. Because so far, the survivors that I've spoken to, they had very, strong family history. Yeah. Several, female members of the family had the same issue and then later had it.
No mother, no grandmother, no maternal, paternal, nothing.
I think only reinforces the idea that any one of us could have it.
Anybody.
When we say 1 in 9 women is at the risk of, or has.
It is going to increase, right? Because of the ignorance and God knows what they think, why they don't examine themselves, they don't go for their regular memos and all these kind of things. So that is a very contributory factor.
Absolutely.
So there was somewhere January. And then I got my first ultrasound done. Not in Shaukat, but my brother and my husband got it done and my brother was looking at it and I said, we need to work on it. Don't worry. So God has been very kind with me that immediately I got very instantly, which is very unusual. I got an appointment in Shaukat. I went to my surgeon. There were lots of people coming with me in the room, my friends, their husband, my husband. I told my surgeon, can you ask them to go out? I don't want anyone to be here. He said, why? I said, because whatever we are going to be conversing now, except me, all of them are going to be fainting. So then we talked. I said, I'm not going to cry, but I would not lie to you that for a moment I felt that everything has slipped out of my hand. My career, my kids, my life, everything. Believe me, that was a moment in front of my surgeon. I said, it felt as if, it's just like a sand that's just slipping away. And I shook myself. No way. That was a moment, and I told my surgeon, forget about it, why it happened. I'm not going into it. Let's get it, what we are going to be doing.
True. And that's the right way forward.
Let's come to the solution. Then he told me that, this is a surgery, you have to go, and, then the procedure started.
And this was at stage...
Initial. It was hardly the second stage. Hardly.
Hardly. That definitely plays a very important role.
I think it's destiny.
Definitely. Goes without saying.
Yeah, because it was meant this way, it had. So I could have been worse.
And
we don't know even.
You mentioned was early 2019 when you were diagnosed and then you went through with the treatment, with the procedure. And
first March I had my surgery, lumpectomy.
Okay. You had the surgery first and the radiations later.
No. I had the surgery first, then the chemo, then the radiation.
Okay.
The entire protocol.
Right. And by what time and how many months can we say your procedure was complete?
It started in, I got my surgery done on 1st March. And then I had to wait for 4 weeks. And 4 weeks later, 6 weeks, I guess. And then they started my chemo. And that took like August, September somewhere.
Okay. So when COVID came to
No,
Pakistan
I
more
was off.
specifically.
I think it was 2018 probably. I'm mixing it. It probably it was
Okay.
2018 because
Okay.
COVID was not there.
Not there, it
So
wasn't.
COVID wasn't there.
Right.
So then I had my the worst part is the chemo
Definitely.
that bogs you down, and then after some time, like 4 weeks, then they said now we are going to go for a radiation. And when you have too many doctors in your family, then everybody is on you. So I have this phenomenon that there are too many doctors in my family, so everybody knows you have to get this. And Alhamdulillah, that was very kind of Allah Ta'ala that there was no spread. My lymph nodes were negative, so it was just there.
Alhamdulillah.
Yeah.
And might seem like an inconvenience right now, or maybe back then also, but a lot of other people would think that you were lucky to have so many, doctors in your family. You had their
But the pain I had to go
input,
through.
yeah.
What it had to do, my brother couldn't reduce my pain.
Obviously.
My cousin, who is a very well-known breast reconstructive surgeon, I had to go through.
Of course.
So I think the only thing is that got facilitated was that additional medical knowledge and do's and don'ts. Otherwise, though,
Even once you're out of, chemotherapy and radiations, for how long are you still immunocompromised? How long, are you still more vulnerable towards infections?
it's your mindset.
Okay. Medically speaking, you're not.
No, I of course you have to be careful. I was not taking the food outside. I was not meeting everyone. Obviously, I was not risking it because I had like 6 months, 6, 7, 8 months. I was going for my work, but not very close contact, avoiding this. I did that. So I would not say that I simply jumped and partying around. This was not. So I had to. Good 6 months was very careful, very, very careful in terms of what I'm eating, what I'm not eating.
Of course. Now, I will ask you something that might seem a little off topic, but I assure you is relevant. As a teacher, you have all sorts of students, There's some that respond more to compliments and encouragement and appreciation. And then some students who respond more to fear when you scare them, or you maybe, give them little warnings that, no, you have to do this, otherwise this will happen or that will happen. So what kind of strategies do you employ as a teacher to bring the best out of your students?
I don't know. The best compliment I ever have got from publicly some student thanking me. I think they said they gave me a bottle of eclairs.
Okay.
She said, you are an eclair. Tough from outside, very soft from inside. So they know it, that if she's getting angry, and if I tell them that I want to take pride in you. So I have a very emotional connection with them.
Oh, okay, that's
so
lovely.
if I'm angry with them, I don't shout, I don't yell, I don't scream, I don't humiliate them. I just look at them.
Okay. But you don't scare them in any way.
No, not really. They don't take me that much away. They know that she's going to be there. Although she's, telling us and warning us. But by the end of the day, like a mother, she would be right behind us. And that's what they know. So I don't want to create fear of examination in them. I usually go in my university and even for A-level students, I said, yeah, are you prepared for your test? You tell me the truth. They said, okay, ma'am, 50%. I was just coming and they said, ma'am, we'll fail. I go, okay, let's not take a test. I'm going to take it on Monday. You guys get prepared. So I said, okay, fine.
Take your time.
So why to put a pressure and, just, they're already in a miserable state. They're completely unhappy. So I don't do that. I actually, I'm not bragging, but I teach from heart.
Yeah,
so I get connected with them. So Alhamdulillah, this has been my 27 years and I am connected with most of my students.
That's very nice to hear.
So they see a mother.
Of course, I'm sure.
Probably.
There's always, I think, among teachers, there's one or two that students also identify as a motherly
figure. This is what
figure.
I learned from my universities and my colleges, my Grenade, my government college. So this is what we are passing. What we have learned from our teachers, we're just passing the same light. So we have a different strategies, and we are friends, but they know there is a limit. She won't cross, and she won't not let us cross that. So that's a mutual bond.
Because as we interview here today, obviously we're looking forward to hearing your story. But I think somewhere in the back of our minds, how we are making you repeat your experience, the worst part, the bad part, the painful part is that some people might learn from your experiences in a way that they empathize, and some might also fear the experiences that you've had. They would hear of the pain that you've been through and be scared, and then maybe somewhere be motivated to self-examine, be motivated to maybe see a doctor more regularly or more quickly when needed. So
I think when we are promoting health, fear appeal is a very effective strategy. We need to create a fear.
definitely.
These inhibitions that I'm not going to go for an examination, the shame, the God knows self-created religious beliefs, but you have a disease or God forbid, you're in the process of getting it. It's better to get it diagnosed and detected and go for a treatment rather than having something miserable.
Absolutely. Over the years, I've interviewed other survivors also, and it at times is surprising, it's shocking, not in a good way, of course, that women would not even mention it to their own husbands. They wouldn't mention it to their own families.
Because they think it's very normal. It's okay.
No, they feel shame in accepting. They felt maybe a certain cyst or something. They're doubtful about it. In a certain case, I remember this woman telling me that for months I could feel it's growing. I, somewhere in my heart, was very sure this is not right. And I still didn't mention it to anybody in the family. And she waited for, I think, 2-3 months before even mentioning it to someone in her family. And that is how the situation still is somewhere.
This is the clear example of absence of self-compassion.
True.
We have multiple roles to play, fine, but we can't ignore our own selves. If we are fine in terms of health, only then we'll be moving around and playing different roles. So I think this is something which we all need to work on, that whether you're educated, whether you're living in developed cities or cosmopolitan, or you're in a primitive area, you need to take steps. Right. So I think that is something which you should not be ignoring it. There is some sign. So why are you ignoring it? So that's something I think the female should know. And the most important thing is that now, today, and as far as the statistics are concerned, it's not age-bound.
It isn't. It isn't at all.
Not at all. So younger generation, elderly, middle-aged.
Women in their 20s, married,
anytime.
unmarried. I know of 2 women, in fact, who were expecting, who were pregnant. And they developed breast cancer while they were expecting.
Yeah, I also know one girl like this. And when I was sitting in Shaukat Thanam one day waiting for the radiation and not in a great mood, you're a lot of things going around in your head. And there was somebody sitting next to you, which I never noticed her. And I was too preoccupied and thinking. And she said, ma'am. And I turned around. If somebody's calling me ma'am, this means he or she would be my student. And there was my ex-student. Maybe a girl as old as 23, 24, sitting in a much miserable condition. For us, there were so many hormonal changes, childbirth, God knows, these things. We have so many reasons we can attribute, but for her, she wasn't married.
She wasn't.
And the mother was hiding it, that we are not going to be letting it know to anybody that how she's going to get married.
How is she going to get married, of course.
I said, are you out of your mind?
We still prioritize that above her own,
her life,
health and life.
Her life is more important than marriage. Focus, pray, do something to save her. Rather than talking this kind of ridiculous thing that, okay, please don't tell anybody that, how we'll get the rishta. So that's very unfortunate.
So continuing our conversation with you, since, like I mentioned earlier, we were happy to know that you have not only a background in psychology, but you practice and you teach psychology as well. So you'd be able to, sort of shed light on some aspects that other people we might have interviewed would not have been able to talk about. We have talked about the physical pains, the challenges that come with, finding out that you're suffering from something like this. Now, to shed a bit more light on the emotional, on the psychological aspect.
Yeah.
Obviously, that journey was difficult, more difficult than most of us can imagine or even understand.
Yeah.
Even post-recovery, does it take time to recover? Because obviously, it's a whole emotional challenge as well.
Yeah.
It's a whole traumatizing journey that you go through without knowing whether you will come out successful or not, without knowing whether you'll survive through this journey or not.
Totally.
So even once you're out of it, medically speaking, your reports are clear. In what kind of a place are you emotionally or psychologically?
When I was going through this, apart from the physical pain, as you have mentioned, no doubt about it, there was a lot of trauma, the why me's and all this. I think two things actually helped me in retaining my psychological well-being. Firstly was an untiring faith in Allah Ta'ala, which has been always there with me. It's just not this journey, but probably he wanted me to get more closer to him. So this is why he did this. So I became more closer. And the second thing which actually helped me to survive was, thankfully, that I studied psychology. Thankfully, I was in love with this subject, because this subject gave me a lot of strength. I still remember, I mean, like, I'm not bragging, but, I'm sitting for my radiation, and I'm waiting, and there is, there's a little commotion in that room, another room, and there was a lady, middle-aged lady, and she had something to do with her, somewhere she had to receive her radiations on maybe neck or brain area, something, I don't know. But she was so phobic that she was screaming her heads off while lying down, and the moment they used to place that cover on her head, she was just out of control. I went there. I myself was there waiting for my radiation, but I went in another room. Of course, you were there
as a patient.
Yeah, I was there as a patient. So I went there, because they were young doctors, probably they were, not able to help
handle her properly.
Maybe she was getting a little too out of control. Then I went in that scanning room. I talked to her for a good half an hour, and, told her that how important it is. But she was so scared. The poor soul was so scared. Then I realized that what a blessing this subject is for me.
Definitely.
Which is not there for everyone. Everybody is not a psychologist. We don't even value this subject. We don't know the essence of this. Now, me standing over there and telling that patient, and after half an hour, I have to go for the radiation myself. So I think it really helped me out. Now, when I was having my third chemo, I've never done this in my life. Somebody came to meet me to visit, and I said, I told my husband, I don't want to meet anyone. Please, can you just, this was perhaps the only time in my life I remember that I've done something this. But I sat that day, I refused, I don't want to go. Everybody was saying, chalo, bahar chalo, let's go for a walk, I said, I don't want to go. Then I told myself that, I will definitely come out of this physical problem. But I could feel that emptiness that, coming towards me. And I told myself, no way, I would not allow depression to come here. It's gonna kill me. I'll be out of this disease. Halfway, I'm done. So I think that is one time I said, that's it. Then no way looking back. Then I'm going out, and, jitna strength I was going out, and trying to come back to life. So I think that has been my major pillar also.
Must have been.
Yes, for sure. And each day, is a struggle up till now.
Must have been.
You have to take medicines. You have to take those medicines, and your body's aching. You are striving to get up in the morning, and I don't focus on these things. I've taken it as a part of my life, and I'm enjoying running around. Who cares about the pain?
And how do you see how, obviously it is important, but how significant or how majorly contributing is family support during these times?
Too much. You need to have that. There are ups and downs. You are feeling miserable. At least you see them, and then they're around you, and they should be around you in a positive manner. They should not make you feel miserable. So I tried, actually, I think that I've tried to be very normal in my activities. So sometimes I used to tell my kids, aren't you taking me too normal? Please.
You even continued working during this time, you mentioned.
Yeah.
That must have been difficult.
Tough call.
Physically, it must have taken a toll also.
Yeah, but I think I said, okay, let's do it. So that was the time when I was under my chemo, and I used to ask my husband to drop me off or wait for some time, and and I had that lovely management everywhere, and they said, you take your time. You want to come for half an hour, you can come. You can come for 1 hour, you can come. It's up to you, right? I'm being blessed with this kind of respect. Yeah. But when radiation part came, it was almost a month, they said. Daily basis, I like 5 minutes, 10 minutes, but it is a procedure. first week my husband used to take. Then I said, you can't affect your work and, kids coming from university and everything. So I used to go for my work. On way back home, I used to get my radiation done. There was some lady in the reception. Every time I used to go and she used to say same thing. Ho, ab kaam se aa rahi hai? Ho. Once, twice. And then I said, that's it. I talked to my oncologist, Doctor, what is wrong? Am I doing something wrong? You just stop me right over there. I'm coming from my work and I get my radiation done. I take a cup of tea from here. I sit here, take my cup of tea.
Sounds like a very healthy approach to it.
And then I take my car, I drive back home myself. What is wrong I'm doing? Why she's saying this? Then he narrated another story. She said, you're absolutely on the right path. Don't listen what she's saying. You are doing the right thing which you have to do. So 1 month when I was getting it done, I was working. Of course, I was driving. I was going by myself. I have all those selfies taken in my car. In all those phases, I have it. And when it was the last day, at that time, my mom, abhi unko 2 saal hue, she was alive. And I called my mom. That was around at 8 or 9 o'clock at night. And I bitterly cried. And while sitting in the ground of Shaukat Khanum, I cried as if I felt that वो chains टूट गई मैं आज़ाद हो गई हूँ, उसमें से निकल गई हूँ. That was my first inner feeling. And I called her and I screamed and and my mom said one thing, why are you crying? I didn't like this first. I said, Mama, it's all done. She said, I think you should be praying and you should be saying Shukr Alhamdulillah.
Absolutely. Because not a lot of people get to say that.
Yeah.
Not a lot of people actually reach that end of the tunnel.
This is the amount of positivity I think I've inherited from my parents also. So she said, don't cry. Why are you crying? For what you are crying? I think you should be happy, thankful. Sajda karo, namaz padho, shukr ada karo. So that was that time. But whenever I go for the regular follow-ups and all this, it haunts me. It haunts me. So, but it's okay.
It's very brave of you to still come here and, go to multiple other places like you mentioned right before we started this session, that you talk to people about it. That's generous of you.
Yeah, initially, I thought about it. Why? I'm not ashamed of it.
Shouldn't be?
Yeah. And if I'm talking about it, if I'm spreading that light, what's bad in it? So I took some time. I mean, I've been doing for since couple of years now. And I said, so, why should I hesitate?
Absolutely.
It wasn't something dreadful or, punishment from Allah. No, it wasn't. It was not a result of it's going to happen to anyone. Anywhere, anytime.
Absolutely.
So the only thing that I did not like, that people having a lot of pity. As if you are a very sinful person. And this is the result which you have got.
I think it's very important to talk about that also. I would like कि मज़ीद ज़रा तफ़सीलन आप इस पर ज़रूर बात करें, because as a society, a lot of times we don't know what to say, what not to say. हमारे यहाँ लोग बहुत
time we don't know what
absolutely और बड़े ruthless questions भी होते हैं. Now I've often seen situations where people have maybe say some skin issues, something on their face. And people would be like, ये क्या हुआ है? ये मुंह पे क्या है? ये क्या तकलीफ? हो इतना खराब लग रहा है. And they would just casually throw these remarks around, not realizing how, how terrible the other person feels. Because obviously if you...
We are insensitive, no?
We're
As a
insensitive.
nation, there is no empathy.
Or we are trying, I don't know what are we trying really, but we think...
We don't know what we are saying. We don't know that how injurious the words are.
And for how long they can affect somebody, how long they will stay in their mind.
That's what I'm like. There is no sensitivity level at all. So you will pin and I prick that person where it hurts more. I don't know why. I'm like, why you have this view that you're safe and sound? So I don't find any reason people saying, it's good, you calm, talk normal, right? Why you have to make him go back again and again and think about again and again, think about again. And probably God knows how much effort that person has taken out to come out of that. That's his or her journey.
Absolutely.
So why you have to go and push him back to that thing? So that is something which I did not face much, but still I could sense, because probably I could sense more because of my subject and my profession. So, but that afsos and no, that's
unnecessary remarks, and at times unnecessary medical advice also. Because when you're seeing proper qualified doctors, मगर लोग आके अपने टोटके भी बता रहे होते हैं, you should ये किया होता तो आज ये ना होता, things like that.
I talk to my cousin, I talk to my doctor that these are things which I've been doing and all the precaution and whatever we are supposed to. You tell me why it happened. There was a pause and a silence from them side and said, we don't have any reason. It happened. It was destined. It happened. Biologically, no reason. We don't know. I mean, like the way you have been carrying your health and everything, but it's okay. It's gone. What I mean, like one thing, the most beautiful thing I got out of it, that I got entirely a different level of connectivity with Allah. Entirely a different kid. When I was going through my chemo, when I used to lie on the bed, and I used to think about anything and it happened. And there was a time I got scared that mere muh se kisi ke liye kuch bura na nikle, kuch na, because it was like, as if he's right over there. That feeling.
You felt so close.
Oh, that was amazing. So I said, okay, not a bad deal. Agar ek tumor और इस journey से अगर आपको अल्लाह का वो level मिल जाता है तो I don't mind. I still gained. So I think एक बहुत next level की मुझे spirituality, मतलब I always but ये level तो मुझे नहीं experience हुआ था. ये मुझे इस journey में और उसके बाद तो फिर अब maintained ही है. But it really helped me out in that ways. Maybe God wanted that connection.
Absolutely, alhamdulillah for that.
So that, of course, that's why He had pushed me and then pulled me back. So,
Ms. Komal, needless to say, it has been a pleasure having you here. It has been so nice talking to you about this. And like I said earlier, but I would definitely repeat it again, very kind of you, generous of you, brave of you to come here and talk about this journey. And
we have to step out. We have to step out and speak. Whether it's mental sickness or it's biological sickness. Stop hiding. Because, then you come in a state where there's no cure. What is the problem in females? Why they don't do the self-examination? What is the shame? Save yourself. Save your life. And same goes for the mental health also.
Definitely.
So we need to recognize this. Let's not be in denial. Right? So if we are not going to be spreading that awareness, and we as survivors probably can narrate it and give them hope that, see, we are still alive, and we are working, and we are trying to live normal life. Of course we have to exert a little more physically, but definitely we are there. So if we can do it, why you can't do it? Don't give up. Don't be so psychologically demotivated. When I used to go to Shaukat Khanam, it's a painful scenario.
It is.
Everywhere you look, right, left, everywhere where you look at the kids, and everywhere there's loss of hope.
It is.
There's silence is like a death silence, right? But still, actually, we should not be thinking that, all is gone and we should not try. Because if you have a positive mindset, your body starts responding that ways. So I personally believe that be a little stronger. And there's no need to play a victim. So if God has given you that strength, get up. And inshallah, He's there, then everything would happen.
Inshallah ji. Thank you so much.
Thank you.
Thank you so much for taking out the time. Thank you for speaking to us.
Thank you.
Ladies and gentlemen, with this we come to the end of our today's session. But definitely, as we always promise and we always make sure that we keep coming back to you with more interesting sessions every time with these amazing guests that we have on the show usually from different walks of life. We will continue these sessions with you. Have a good day ahead. Allah Hafiz.